Wondering if you have spinal stenosis? Let's check out 5 common signs and a super quick home test.
A lot of us ask this, but leg pain when you walk isn't always just part of aging.
Sound familiar? This isn't just a feeling. It's a pattern that points to a very treatable condition.
Okay, let's dive into the 5 big signs. If 3 or more of these hit home, it's worth a closer look.
All right, let's kick it off with sign number 1.
Your legs feel like lead, but you're not winded? That's from nerve compression, not a lack of fitness.
And now for number 2. This one is the biggest giveaway.
The pain just vanishes the second you sit down? That's the classic clue that separates stenosis from other issues.
And this chart says it all. See that pattern? Walking brings on the pain, sitting makes it disappear.
On to sign number 3. Now this one might surprise you.
Yep, just standing there can feel worse. That's because it keeps constant pressure on the nerves.
Okay, sign number 4 is all about which legs are involved.
If both legs are affected, it points to compression right in the middle of your spinal canal. And finally, let's get to our 5th and final sign. Stenosis is tied to age and wear and tear, so old back problems can be linked to these new leg symptoms.
So how can you test this out for yourself? It's easy. There's a simple 1-minute home test.
Just walk at your usual pace, see when the symptoms start, then sit for a minute and walk again.
If the symptoms come back at the same distance every time, that consistency is a really strong indicator. So why does leaning forward feel so good? It physically opens up your spinal canal, giving your nerves a break.
And there's definitely hope. This patient got back to their morning walks without surgery. That's super common.
You should think about seeing a specialist if your world is getting smaller because of the pain.
Okay, listen up. Most symptoms aren't an emergency, but some absolutely are. You need to know these.
If you experience these red flag symptoms, don't wait. This is rare, but it requires immediate medical care.
Knowing what's going on is step 1. So now, what's the first thing you'd do if you could walk with ease again?